We'd like to take a moment to remember all those who lost their lives in the floods here in Texas this month. We will continue to keep the families, friends, and everyone affected by this tragedy in our thoughts and prayers. We would also like to say thank you to all the first responders from Texas and around the country that came together to help. We know this was an extremely difficult assignment for you, and your dedication to saving lives and community service doesn't go unnoticed and is greatly appreciated.
You are listening to EMS with your hosts, Erik and Matt Ball.
What's our topic?
Well, you know, there's actually I have no idea what we're talking about. I'm just kidding. You know, it's summertime, so
yes. We talked about hyperthermia recently.
Submersion injuries.
That's right.
So submersion injuries, another important topic, especially for the summer, and something that's deadly.
Yep.
Something that can really, you know, responsible parents, just 1 second of I thought dad was watching kid, dad thought mom was watching kid.
Yes.
Oh, just disaster. I've seen some of the saddest stories in the ER.
You should be on scene with those calls. They are horrific, and the screams of a mother like that are something you will never forget.
It can happen to anybody.
It happens so fast.
It's hard because sometimes kids get into this situation because of neglect, and CPS does need to be involved.
Yeah.
And I know at our hospital, CPS gets involved in all submersion injury cases.
They at least investigate it.
Investigate it. And so sometimes parents are like, this adds insult to injury.
Oh, yeah.
I had a friend of mine that was involved in something like this, and they called me and said, why are they doing this to us?
Yeah,
it's like, hey, listen, it's just a protocol.
They have to do it.
They got to do this.
Yes.
But anyway, so submersion injury. So sometimes people call it near drownings or drownings. Well, drowning, you're dead, so we're not really covering the dead people.
Right.
We're talking about the submersion injuries.
Right.
And there are variations to how sick you can be based on what we find. But it's pretty obvious that we need to breathe.
Yeah. Kind of an important thing.
And if you're underwater and you're a little kid, or somehow you're in a river rafting accident and you aspirate water, it doesn't take long to have a bad outcome.
Yeah.
It does not take long.
It floods out your alveoli, it inhibits gas exchange.
That's exactly right.
And it just, causes...
The blood's flowing great.
Yeah, you've got blood in your body.
In fact, it's probably going really fast.
Yeah, exactly.
There's just no air
which
there
is
for gas
expediting
exchange.
the problem. Yeah,
exactly.
Your organs are, like I say, they're flooded out, you're washing out all the oxygen, and you can't perfuse your vital organs.
And then on top of that, when you aspirate, you increase risk of infection.
Yep. Another thing that people don't think about.
That's right.
They prophylactically, don't they usually put these patients on antibiotics?
Yes, in the hospital. The other thing that I think is worth talking about are some of the risk factors. We're not going to cover all of them, but alcohol is a huge one.
Yes, we recently had a tragic case here in the Dallas area where I don't know if alcohol was a factor. I'm not saying that, but multiple times a year in our area, with all the lakes that we have every
having
year,
a good time, boating,
out on the boats,
good
water
friends
skiing,
and family,
drinking, having a couple of drinks.
Be careful.
It's a recipe for disaster. It happens every year, and it's so sad when these things happen to anybody, kids, adults.
I lost one of my best friends to a boating accident.
Really?
Yeah, because of something like that. I don't know necessarily if alcohol was involved, but it was a boating accident. Thought he drowned. Never found the body.
Yeah, that's the other tragedy. We just recently had a case just north of us where I don't know, it was a father and daughter went downriver. I know they found the father's body, but I don't know if they ever found the girl. I know it was several weeks.
You got this. I'm going to keep laughing. I'm sorry to interrupt our podcast, but you got a string hanging down.
I'm like, you're laughing at the story as I'm telling this. There it is.
I'm so sorry.
It's distracting this. Sometimes you got to laugh when you're talking about deep stuff, right?
That's one thing I love about our podcast. And
I thought you were going to tell me I had a bat in the cave.
No. You look great. You just had this long string hanging down between your eyes.
I couldn't even see it. That's funny.
Anyway.
You got to love live studio.
No, we do. We have a good time on this show. But
yes.
This is a serious issue.
Yes, we're not laughing about the seriousness of these issues. They're tragic for families, but they happen every year, and a lot of times they're preventable.
They are.
Right? Just being a little bit smart, Not getting too crazy. We're not saying don't go have a good time, but be smart.
Yeah, be smart. And when you're out there at the pool or whatever with your kids, you've really got to keep your eye on them.
If you have a pool at home, I know like in the neighborhood I live in, actually in the city I live in, it's required that if you have any pool, you have to have a fence around your backyard.
Yeah.
So somebody can't come in, or if they jump your fence, you're not liable. But if you have a pool and you have small children, have some sort of alerting system.
Yep.
Put a gate around the pool itself with some sort of an alerting system that somebody gets out and opens up that door, and you're in the house doing whatever, being just a good parent, cooking dinner or something, and your kid walks out. I mean, these are not malicious things on the parents.
No.
They're doing their thing, and the kid gets be careful, take precautions, teach your kids about pool safety.
And it's not just the pools, it's the bathtubs, even buckets with little kids.
That's right.
You fall into a bucket of water or whatever it might be head first, it doesn't take long. It's essentially, you're drowning.
Yeah.
You don't need a pool. You don't need to be fully immersed to drown. So something that's really, really important. You have a seizure disorder, or whatever it might be. You can really be careful.
Diabetes, low blood sugar, you get altered.
Right.
Yeah.
And if you have a seizure disorder, you should not be bathing the kids.
Oh, I never thought about that. That's good. Yeah,
be
alone.
Careful, be careful. Alone. So
it's a good point.
Yeah,
so
things to just be careful.
Yep.
And just so many things that can happen. Nobody intends to hurt a kid, obviously.
No.
Well,
let's hope that's the case.
So,
yes.
But you just got to be careful. It happens to the best of parents. Like I said at the beginning, I thought Dad was watching. Dad thought Mom was watching.
Exactly.
And then they find baby.
I think every parent probably at some point in their parenthood has had a moment where like, I thought you were watching the kids. I thought you were watching the kids,
Yeah. Oh, yeah.
And we all just got lucky for the most part that something bad didn't happen, right? Yeah. So first responder, or you're a nurse, doctor in a hospital, and you get that drowning patient.
Yes.
Right? So obviously, if you're pre-hospital, first thing is got to get them out of that environment. Right? Get them out of the water. Get them out of the water, right?
What's the first thing we should do? I think
once you get them out of the water?
Repeat, I think, is the way we taught this in our lecture before.
Right.
Check for responsiveness is the first thing we should do. So patient, you get called, they were in the pool. Obviously, hopefully by the time you get there, they've been removed.
Hopefully.
And the first thing you want to do is to see if they're responsive. Yeah. And if they're responsive, that means at least a 78%, at the minimum, a 78% chance of survival based on data.
And that's when you say responsiveness. We're not talking about alert and oriented. Right? We're just saying if they're awake and even looking at you, talking at all, they don't have to have a GCS of 15 necessarily.
No.
But if they are alert and responding to you, that's a good sign.
Yes, that's a good sign. Now, if you get to that patient and they're not responsive, it's not necessary that you just immediately check pulses and start chest compressions potentially, right? The first thing you want to do if the patient is unresponsive is to give them 5 rescue breaths.
That's right.
That's our protocol. Now, if your protocols are different, you're listening to this, follow your protocols.
That's based on data, though.
It is.
Yes.
And when you oftentimes breathing into these folks will restart the heart, kind of like you kickstart a motorbike, right?
Because typically these are younger, healthy people, right?
That's
For the most part. They don't have comorbidities. They're not on a ton of meds.
That's right.
The problem is they've got fluid blocking.
Correct.
Yeah.
So getting the rescue breaths can oftentimes be what really gets them going again.
Be ready for them to start puking.
Now, if after rescue breaths, obviously they don't come around, they're still unresponsive, we're going to check pulses.
That's right.
So if they do have pulses, now we're getting down to 56, I think to 59% mortality rates here is starting to get ugly.
Yeah.
That's not good. They'd probably been down for a little while if you get to that point.
Yeah.
Now, if they don't have pulses and you're there, then you got to look for time.
Yeah.
So pulses,
time of submersion.
Responsiveness is the R. P is for pulses. T is time. You get to that patient that doesn't have pulses. How long were they down? If it's more than an hour, unless it's hypothermia, really cold, maybe. There are cases of folks, CPR for 24, like a long time, the whole, hours and hours.
Right.
And you can survive because you're so cold.
That's right.
So, but if you don't have pulses, and you've been down for longer than an hour, but if you've been down for less than an hour, now you're getting down pretty high mortality rates. We do everything we can.
Yep.
And I've had many patients like this where we send them up to the pediatric ICU, and we just pray that when we turn the sedation off, they've got brain activity.
Yeah, and the biggest thing I would say is, these are terrible calls. Obviously, we've said it for the families. These are also terrible calls for the responders.
Oh, yeah.
But it's important to remember, don't be in a rush, right?
Yeah.
If you get that kid at the pool, any patient really, there is no reason to rush to the back of the ambulance right away, right? Start working the problem there. We know what the problem is, right?
Yep.
Get them, start ventilating, right?
Yeah,
Start ventilating, start
if they're not
oxygenating.
responsive.
If
Right.
if they're not responsive, that's, or if they're pulseless, right? You've got to start ventilating these patients. Get a tube if you're allowed to do that.
Yeah.
Get get a definitive airway in there. That's going to help because aspiration is a huge risk again.
Yep.
Start oxygenating. Don't be, especially with these pediatric patients, so often first responders, their go-to is get them in the back of the ambulance and let's just go. No, there's nothing you're going to do in the ER. We say this over and over and over again. There's nothing you're going to do, for the most part, in the ER in this situation that I can't do pre-hospitally.
Yeah.
If you're allowed to intubate, RSI, things like that, if you can do those things, do them.
Yeah.
Don't be in a rush to rush off to the hospital.
And those rescue breaths, like we talked about, can turn these kiddos around.
Real quick.
So you follow your protocols, but remember, rescue breaths. If that patient's not responsive, that can turn them around right there.
That's right.
And then check those pulses. Following your protocols with CPR if necessary, and airway protection.
Remember, if you're going to intubate or defibrillate, dry them off.
Yep.
Get them out if they're laying. Get them out of that wet environment. Dry them off before you stick the pads on them. Go to defibrillate. Something that in the fog of war you forget, right? You don't think about it, but remember those kind of things.
That's good.
Very, very important stuff. So get them out of the environment. Right, start treating the problem. Rescue breaths, ventilations are key.
Yeah.
Right, if they're in cardiac arrest, start working your cardiac arrest protocols, chest compressions.
Yeah.
Defibrillation if that's indicated. Throw the Lucas device on them if they can fit in the Lucas device. Get an airway, whether it's a supraglottic airway. In these situations, I would say that these are patients I want to intubate.
Yeah.
Right, supraglottic airways. A lot of times in a normal medical CPR. That's probably that we've talked about. The data isn't really beneficial for intubation.
Yeah, for sudden cardiac arrest, even BVM.
If you're getting good compliance,
doesn't show any out-of-hospital mortality benefit to have, based on the data that I've read and the Corcoran review that I read.
Yep.
So,
would you say in these patients, would you agree that you would probably want to get a tube?
Well,
on these
you always
patients?
want to shoot for the definitive airway, right? You always want to shoot for that, and to me. There are many situations where the iGel could be a great temporary, airway.
Yeah.
And I think in these patients, getting the ET tube is ideal.
Yeah. And that's, that's been, I've seen that a lot on social media now, people talking about, intubating in cardiac arrest. And we've talked about this before, but it's all based on the patient presentation, right? Yeah. If I've got a patient that's maybe in VFib, not a drowning patient, a medical patient in VFib, and I'm trying to work that problem, and I've got a supraglottic airway in, and I'm getting good compliance on my bag, and I'm able to ventilate.
Keep it.
I'm not worried about intubating that patient right now. I'm worried about converting that rhythm. So meds, electricity, that's what I'm trying to focus on. I might intubate them down the road, but it's all about prioritizing. And I guess what I'm saying is, in the drowning patient, I am prioritizing getting a tube higher than other patients, is my point.
I see what you're saying. Yeah, the ventilation is key, especially in kids, and we got to, and similar to a trauma situation, right? You got to, once you're through your algorithm, you got this sick patient that was a submersion injury, less than an hour underwater. You got to treat the sickest things first.
That's right.
So
another thing too, when you are going to intubate these patients, think about suction. Suction, salad technique. Obviously, they've got fluid,
a lot of
right?
contaminants.
Especially if you're doing chest compressions. That's going to be coming out. So be prepared for that as a first responder.
It's really key.
Suction, and learn that salad technique because, again, in these cardiac arrest situations, you're going to have a lot of fluid coming out. So be ready for that when you go to tube.
Yeah, a lot of fluid. The other thing that you might want to think about too is oftentimes when we see these patients and we get there on scene, it can be a party situation with a lot of people. It can be a family situation in the backyard pool. There can be a lot of dynamics, and sometimes
chaotic.
I've been in situations on ride-outs where we've had to just use the ambulance just to separate.
Sure.
patient
Sometimes
care
you do have to get in the back of the ambulance to keep ourselves safe.
Yeah.
And that brings up another point, and I think we've talked about this, is that, there's always the controversy of, if it is a kid, do we let mom and dad watch, the resuscitative efforts of us or of the staff? And studies have shown that it's actually better for them in the long run to watch us, as long as they're being safe, right? They're not interrupting us. They're not obstructing us from doing our job. If
in the ideal situation.
In the ideal
certain situations I could see. Maybe.
If they're being chaotic and then you got to get them out of that situation. But if mom and dad, obviously they're going to be upset. They're going to be emotional. There's no getting over that.
Of course they will, yeah.
But if PD has them, or maybe the officer has them off to the side, like, hey, and explaining to the parents, hey, this is what we're doing. He's doing chest compressions to to circulate the blood. This guy, he is ventilating. He's oxygenating your baby's body. He's getting an IV. He's going to give him medications to try to, whatever the case may be.
Right.
That is shown to be good. If the worst happens, the parents realize, like, I watched them. They did everything that they could to try to save my child. And not that they're probably ever going to get over that, but maybe in some small sense it can give them a little bit of peace that we didn't just blow it off and we didn't try. We really tried. Yeah. We tried to do everything that we can.
I could see how that'd be helpful.
Yeah, something to think about.
There's just to back it up a little bit with the what's killing these patients. It's the anoxic brain injury.
Yes.
We get the heart started again. You bring in a submersion injury to me in the ER. Yeah. Maybe we'll, who knows, stabilize them a little bit more. Get the IV, maybe another IV in, start those antibiotics or whatever it might be, right? Yeah. But really, the answers come the next day.
Yeah.
It's when they're in the ICU and we're extubating or turning the sedation down to see what brain activity we have. Right. So that's the key. So if you do have that patient that's pulseless and you did the rescue breaths and it's not working, and it's a 20-minute whatever, or 10-minute or whatever,
transport,
and they're pulseless.
Submersion
time. The brain cells are what we're trying to save.
Yeah. It's the same thing in a medical cardiac arrest.
It's exactly
the same thing.
Yeah.
Yeah, that's what we're trying to save, because we can probably get the heart to start beating with enough epi, right?
That's right.
Why have we gone from doing 10 rounds of epi to 3 rounds of epi? Because the vasoconstriction in the brain. Because we can get the heart beating, but you've just killed the brain because there's no circulation up there.
And that's why time is so important too with stroke. It's the same thing with stroke. It's all the same pathophysiology. It's we have blocked blood flow, or somehow we're not getting oxygen to the brain.
That's right.
And the brain cells are so sensitive to the lack of oxygen.
Yep.
And they don't live long.
That's right.
And it's irreversible.
Yeah.
And what happens, I think it's interesting. Even as in the pre-hospital environment, I like to kind of see the pathophysiology of how things progress. Mm-hmm. So it's really interesting. This is how it happens: is that when you have impoverished brain cells from oxygen, they die, and then when they die, they swell.
Right.
And it's that pressure. It's the swell, it's the pressure. When you increase the pressure, you're not getting blood flow to the brain. The blood can't get in.
That's right.
Because that brain bucket.
Just like in a TBI.
That's exactly right. Yeah. So that's what we wait for in the hospital. We wait and we pray to see what the responsiveness will be, if there's any brain activity at all. That's the name of the game.
Yeah. So let's talk about, if somebody, they turn around and they see their kid in the pool. And they jump in, they get them out of the pool, and the kid's awake and alert, should they call 911? Ambulance.
Great question.
What should they be thinking about as far as, I think he's fine. He's acting fine now. I don't think we need to go to the hospital. Should they transport? Like, what's, we talk about, up to 72 hours, right? You can still die just because you get,
gotta get them checked.
I agree.
I'm no fun to have at a party. I'm going to tell you right now. It's nobody wants to take their kid. Right. It's scary sometimes to take your kid to the ER because they had a submersion injury. Right. What's going to happen? Who, the CPS, all this stuff.
Well, I think more than that, honestly, I think being on some of these calls, a lot of times it's like, oh, they're fine. Yeah, they were underwater for a few minutes, but they're fine. They're awake. They're running around and they're talking.
That's really dangerous, potentially.
Exactly. That's the good message.
We need to get the vitals. We need to get that. Oftentimes, the chest X-rays indicated. There are certain medical standard of care procedures and protocols that we follow
that we
based on the
can't do
data.
pre-hospitally.
No,
that's
no.
why they need to go. That's what
that's
I'm saying.
right.
Yeah.
So get to the ER. There are certain situations where I've told families that, oh, well, you know what, based on your story, there's no risk here.
Yeah.
Let's just check a couple things, watch them for a couple hours, and we send them home.
Fine.
Probably going to be fine. But there are those situations, those real situations where the kid seemed fine talking to me. Well, you can really cause some serious injury with, depending upon how much, liquid you had aspirated.
And there's no way to know that.
No.
You don't know. You have no idea. And especially those situations where, well, how long were they under?
Mm-hmm.
I don't know.
Yeah.
We just went out and we found them out there. Like, it might have been 30 seconds. It might have been 5 minutes, you know. And so, I think that's important for first responders to realize that you get called out to one of these near drowning calls or a drowning call, and you get there and, mom and dad are out with the kid and the kid seems fine. He's got good color. He's responding to you. That doesn't necessarily mean he's out of the woods 100%.
That's correct.
And it's always best to encourage mom and dad, look, I know he looks fine now, but I think it's probably best because we're limited with what we can do here pre-hospitally. I think it would be best. And you know what? Just some verbal judo. Mom and dad, no, I don't think we need to go by ambulance. Okay, fine. You understand the risks. Obviously, we want to cover ourselves from a liability standpoint. But then tell them, like, look, please, then you drive them to the ER. If you don't want to go with us, please take them into the ER and get them checked out. We would prefer that you go with us because we can monitor and route in case anything bad happens.
Yeah.
But encouraging them to go is important.
Man, you in these cases, you've got to document.
Yeah.
You've got to document quotes of what you've said and what they said. And
You're explaining the risks, accepting the risks.
That's the thing is you've got to disclose the risks so mom and dad or whoever is taking care of this patient can then verbalize and communicate their understanding of the risks and benefit, and you've documented all of it. In court, it will not stand up if you can say, oh, mom and dad were there and they said that, they didn't want to go to the ER. Yeah. And then in court, they're going to say, well, gosh, I don't know.
Yeah, you're the medical expert.
They let me go. I assumed it was okay. I'm not a paramedic. I don't know medicine.
Yeah. Especially if there's a bad outcome and they're looking for somebody to scapegoat.
Right.
Who are they going to pick?
It's not all about, this. We've talked about this before. It's not all about CYA and all that stuff and defensive
We want to do
care.
what's best for our patients.
Always do best for
That's the main thing.
The key, though, is on these situations, you want to make sure that you have communicated, disclosed
Clearly.
all risks and benefits, and then it's all communicated back to you after they have legal and mental capacity.
That's right.
We don't really want to get into a refusal thing now, but when you're trying to determine whether or not a parent can make an autonomous decision for that kid, it's not good enough to just say, hey, it's the mom and dad. They have legal, custody here, and they can make the decision what they want to do. No, that's not the case.
Have mom and dad been drinking all day at the pool party?
Maybe.
And they're a little inebriated, and they don't, they're not. And what are they going to do in court? Well, they, were drunk.
Yeah.
Or, I know some systems, not to get off on refusals, but some systems are starting to video. Yeah. And take video evidence that the paramedic or the EMT is explaining the results or explaining the consequences of not going and getting. Yeah. Okay, you understand what I just told you. Yeah, I understand. Yeah, we could die if he doesn't go or whatever.
Well, I think this is really appropriate to talk about here because in this situation you have so many kids that look great. Yeah. Same thing with head traumas too. Sometimes a baseball bat to the side of the head, kid looks great for a little while.
Wakes back up. Yeah.
That's right. So knowing the medicine, knowing the pathophysiology of some of these diseases can really be important in doing that communication, that disclosure of information to the parents so they can make an educated decision.
That's right.
And then in court, God forbid, it says here in the patient care report, actually, you know what, if you do a really good job, the lawyer will say right away, you don't have a case here because they told you everything.
Yeah, it's documented right here that, they told you everything and you signed it.
That's right.
But so I think we talked about assessment. We talked about, number one, we talked about prevention. Yeah. That's the best thing we can do to prevent these type of calls, these type of injuries, these type of deaths. You do get these calls, we've talked about, get them out of the environment, start treating them on scene, don't be in a rush unless it's an unsafe scene. Yep. Talked about what you need to do.
Yep. And I would say too, I mean, for your kids, as the summer starts out here, you know, there are free swim lessons you can get through your city. Call your you know, city municipality where you are, and oftentimes they offer free community swimming lessons. I mean, there are ways to be safe out there.
Have you seen the thing where they put the babies in the pool and they teach them to flip over?
Yeah.
And then they just float? It's amazing.
It is amazing.
And I mean, it's crazy when they go test them, you know, and they take this little tiny baby and they put him in the water and he just whoop and he flips over.
That's
and
right.
it's just sits there just hanging out until, oh my gosh.
Amazing.
Yeah, so that's another part of prevention.
Yeah.
Get some swim lessons. Anyway.
Yeah, having lifeguards. I mean, there are certain places where it's safe to swim. You know, you're diving into a pool and you can't see. I mean,
that's another thing that we taled about is, you know, swimming in the ocean or open water swimming.
That's right.
Right? Know your limitations.
Yeah,
Riptides.
right.
You know, if you're from Texas, you know, and you're going out to wherever the coast and you're going to the ocean and you're not used to looking for riptides and things, and you're thinking, oh, I'm a big bad swimmer.
I told you what happened to me. And remember that embarrassing story?
Where you got your pants ripped off.
Had
Had to walk up naked
Oh my
in the parking lot.
So embarrassing.
It's fun. Yeah, but I mean, you're swimming like in a pool and you think you're a swimmer. Yeah, okay, there's no current in a pool. Now you're in the ocean and it is unforgiving.
That's right.
It will
Or a
suck
river.
you out to sea. Or a river. It will suck you out to sea and you're in big trouble.
And then lakes, you know, you got the water sports, you've got potential jet skiers that don't see that kid.
That's right.
That, you know, whatever. You know, make sure you have life preservers in your boat. You know, using all the flags if you're doing water sports. And following the rules of the lake and of whatever you're doing, and the alcohol too. Obviously, that's just you can't say that enough. It's you just drink a little too much and you're not making the right decision.
No, you're doing dumb things you shouldn't be doing. I think it's good to mention salt water versus fresh water.
Yeah.
There's, they used to teach, salt water is worse. They did that study on dogs. There's no real difference between a saltwater drowning and a freshwater drowning.
The bugs are different. The bugs might be different, but as far as
the
one being worse than the other.
Exactly. That study was done on dogs, if I remember right, with the salt water.
I don't know. It's a good question. I don't remember.
That's what I recall when they changed it. That was why that data wasn't very good data.
Yeah, but I remember when we did our submersion injury lecture not too long ago, a couple of years ago, I think. I remember reading that. It's like the whole freshwater, saltwater thing. It's not worth spending time on that. Yeah. It's the liquid in the lung that's not supposed to be there.
That doesn't matter if it's salt or not, unsalted or salted.
It may change the antibiotic choices in the emergency department, but it does not change the management.
Yeah, and I think the biggest takeaway is for first responders is, again, if the patient's unconscious, we're working them, obviously those patients are getting transported. It's that difficult call you get to and the kid looks fine and mom and dad don't want to go. You need to strongly advise mom and dad, look, they need to go to the hospital. We got to get them checked out. Hopefully they'll just be there for a couple hours. Everything's good. You come home. But God forbid something does go wrong, and now we're further down the line of them getting treatment. Always encourage transport to the hospital with these patients. Very, very important.
Well said. This is a great summer message on our podcast.
And go have fun. Go swim. Go have a good time. There's
careful.
nothing wrong with that. Just be careful and be smart.
Don't invite me because I'm not fun to have at the party.
Well, you are if your pants get ripped off.
Oh my gosh.
See you on the next one.
Thank you for listening to EMS, the Erik and Matt Show.